Broadcasting from the business capital of the world, this is the Podcast Business News Network. Dr. Eric Reznik joining us here today live, and we are excited to have him here because he is from Be Well Rehabilitation and Counseling Group, and Ketamine and Wellness Clinic of South Florida. He joins us again here today to talk more about this amazing work he does and how he's helping so many people. I love what you do, and he does a lot, even other things that you wouldn't expect. We're going to talk about that in a sec. He's the first doctor I ever talked about who's into therapeutic martial arts, so he taught me all about that, and will teach you too. So welcome back. How are you today?
Thank you, Nicole, for having me back. Great. I'm doing wonderful. I'm glad to be back in the show and the podcast, and happy to tell the world the great things that we do and all the cool stuff that we do.
Oh,
So,
and non-traditional approaches. Tell us a little bit about what you referencing to so our listeners can get to meet you.
sure. I do a lot of traditional and non-traditional. Non-traditional means that you don't just sit in the office and you talk about particular issues and you work on specific goals. You actually approach problems from multiple different avenues, and it can be from neurological, psychological, experiential, expressive. These are different non-traditional ways of doing it. Most people are familiar with things like
Mm-hmm.
art therapy, music therapy. These are kind of, or play therapy, for example. These are non-traditional approaches. Non-traditional meaning that in the old days, back in the, we're talking about 20, 30, 40 years ago, when a client comes in and they have some issues, they sit down with a therapist, they tell them what they feel like, and they kind of work on their difficulties in life. In psychiatry, you give some medicate some symptoms, and then of course they give you medication, and that's a traditional approach. The problem with traditional approach is that people do not always want to talk directly, or they want to talk about issues that do not that inconsistent with the psyche, or medication is not always appropriate. So I like to use what really works,
Yeah.
and what works oftentimes isn't sitting just talking to the client. I try to use different modalities, and of course, I specialize in some of those things. We talked about last week about therapeutic martial arts, where
Yeah.
I use martial arts in a therapeutic way or as a therapy itself. That when the adolescents or children do not necessarily listen, talk to us, they do things. They kick, they punch, they grapple, and then I use those physical aspects into the discussion of their previous lives and symptoms and how to manage anger, anxiety, frustration, dealing with some family issues, with school issues, with bullying, self-esteem. That's just therapeutic martial arts. The
Got
other
it.
thing that I mentioned that I've done is I do ketamine. And ketamine is kind of a new direction in therapy. Now, I would really want to talk a little bit about more about that because I think people don't know much about ketamine. And I think there's a lot of questions. And I would be happy to take some phone calls and people can ask me directly if they want to talk about the what ketamine does and how it works.
Perfect. Absolutely. Let's make sure we open the phone line 631-307-4010. That's 631-307-4010. Feel free to call and ask any questions. And again, we're going to discuss a little bit about what ketamine therapy is. Thank you.
Mm. So the interesting thing about ketamine, I want to talk a little bit about misconceptions. Um, it is often called a horse tranquilizer, or it's called a street drug. And in fact, yes, it's been used that way. The unfortunate part is complete misuse. So historically, what happened is about 1962 when they derived ketamine from a PCP, which is everybody kind of familiar with the PCP as being hallucinogenic drug and being very terrible for human consumption because of the possible aggression that comes from PCP. This was what we call the waking anesthetic, which is the
Okay.
ketamine, which is the derivative. And we found that it has incredible qualities where people disconnect psychologically and they kind of sort of dissociate. And that's a great thing because what happens at that point is your mind separates itself from the issues, from the problems, and gives you a different perspective altogether. That's ketamine. And so ketamine began to be
Oh,
researched. We
okay.
found that it's really great to use in anesthesia where we apply ketamine with other medications, and then that helps the person to go into a deeper state of anesthesia. In fact, my son had a nose surgery not long ago, and one of the one of the ingredients, one of the drugs was ketamine
Mm-hmm.
that is being used, and he's a later lesson. So it's a really unique kind of a thing. Um, Street drug, yes. People misuse pretty much anything. In
Right.
fact, most street drugs start out as psychiatric drugs,
Mm-hmm.
Xanax, Valium. All those things were given to people to manage anxiety, manage depression, and of course, people find out the other kind of qualities, which is a kind of gives you a cool high, and it's great to go and get these things from the street, and of course, used in a club. Well, why not use a hallucinogenic or a psychedelic such as ketamine? And people did that. And unfortunately, it's unregulated. You don't know the doses that you're giving. You don't know the effects that it's going to have. The only thing people have known is that they give you a great high or disconnection for that matter. And
Mm-hmm.
of course, people misuse it. And if you misuse it in wrong doses, you're going to have tragic situations, tragic results, sometimes even death. I believe the actor from Friends was his name that died recently. Uh, he died from the having ketamine is one of the medications. I believe he died in a bathtub or something like that. Anyway, so that is a tragic end with that. Uh, eh, Now, this is a little bit different. When we use ketamine, you use ketamine to help people to deal with a very strong depression, something that is
Mm-hmm.
treatment resistant, something that people can actually be monitored for. And we are literally have a clinic we designed where we monitor your vital signs, we monitor your intake, we take your weight, we take history, we do an assessment prior to administering those things. They are code compliant. They are monitored by the Department of Health. It is a very incredible responsibility to administer such a medication in an appropriate use. And people have reported a lot of successes. Their depression have gone away. They are able to think differently, feel differently, lose
Yeah.
anxiety, lose depression.
Mm-hmm.
I mean, people literally open up their
Ah,
minds into all kinds of ways
wow.
where they're able to live. So it's a really unique way of approaching
Uh-huh.
therapy. In addition to the administration of drugs, we actually do the CAP or ketamine assisted psychotherapy, where we actually apply therapeutic
Mm-hmm.
techniques during or after. In other
Yeah.
words, person being administered ketamine can actually sit there while they're taking the ketamine, and when we give it a lower dose,
Yeah.
person can actually go into a state and then talk to us and then discuss what they feel, what they see, what they understand. Some people choose to have the full experience and then have a conversation afterwards where they talk about their issues that come up during ketamine session.
Got
It's
it.
really, really effective way. And I've so far I haven't had any negative reactions from almost anybody.
Got it. Wow.
Yeah.
Wow. And I feel like, there's a lot of misconceptions about it. Hold on, stay tuned. Hello, we have a caller. Hi, welcome to the show. You're live on the line. Who's this?
Hi, my name is Brian Davis.
Klein, did you say
I
your
was
name was Klein? Oh, sorry.
Brian
Hi,
Davis.
Brian. Thank you for being here. You are live on the line. Just want to let you know this is live with Dr. Eric Reznik here from Be Well Rehab. Did you have a question?
Hi, Doctor. Yeah, I was curious to know because remember about with Matthew Perry and how he used ketamine, and I thought ketamine was bad for you. You know Matthew Perry, the actor, about how he used ketamine.
I'm glad you brought that in because I
Yeah.
mentioned the case, but I forgot the name. Yes, that exactly what happened to him when he
Mm-hmm.
took
Right.
ketamine as one of the drugs. Unfortunately, we don't know
Okay.
how many more drugs he took.
Yep.
Ketamine has a property that
Oh.
will dissociate you. It will
Okay.
disconnect you from reality. So if you take this with other drugs, it is very, very, very
Uh,
dangerous. And we know
Mm-hmm.
that on the street, that's what people do. They don't take one drug, they take multiple drugs. Ketamine being one of those things. So
ah.
go ahead, sir.
I'm saying, I'm just listening.
Yeah, and
Yeah,
so
that was
so
my
we don't
question.
know.
I thought ketamine, was bad for you.
Mm-hmm.
It's actually not bad for you. Now, if it's unregulated, it's
Wow.
dangerous. Unlike like
Oh,
like
so
every
so
other
so
drug.
ketamine then it's not like lethal. It's depends on the usage and how it's used and why.
Mm-hmm.
Correct, correct.
Okay.
So like any
Good.
drug, it can be lethal if you overdose it. Absolutely. So
Bottom
yeah.
line. All right. Wow. Thank you very much. I was very curious to know. I wanted to reach out.
Yeah. But
I'll even I'll
go
even
ahead,
expand
Dr.
upon
Reznik.
that. I'd like to expand because there are some side effects, and we want to make sure that people don't have the side effects. So one of the common
Okay.
side effects is nausea. People can throw up, and we
Oh,
actually have BART bags available. We give you some medication to counteract it. That's one. Two, it raises heart rate. So if you
Mhm.
have a heart condition or high blood pressure, we don't recommend it, and we usually either give medication to bring it down or ask you to get some treatment prior to coming to us. The third
wow. Okay.
the, absolutely. The third is when you're actively hallucinating or you have
Mhm.
conditions that create hallucinations, we do not recommend for you to take ketamine as well. So yes, if you're on the
All
street and
right. Okay.
if you don't know your condition on the street, if you happen to have some blood pressure issues that you don't know about and you're going to take ketamine, you're going to have some tragic
Mhm.
results.
Uh-huh. Oh, here, see, like something else. Like if
Yeah.
you do too much of it, right? Exactly. Like it can affect the body. I got you. You've been a great help. Thank you.
Absolutely, happy to.
Thank you very much.
So
Perfect. Thank you so much for the call. We appreciate it. And anyone else have any other questions, please feel free to call in as well. 631-307-4010. Ask anything today. We're talking about alternative therapies. And of course, Dr. Eric Reznik, being based out of Hallandale Beach, Florida, has expertise in this. Be Well Rehab, these non-traditional approaches as far as the ketamine therapy, ketamine assisted therapies. We're talking about neurofeedback, martial arts, and so much more. So back to you. Go ahead.
So interesting you said over the misconceptions because I was very skeptical going back about a couple of years ago. I work with substance abusers all the time, so to me, a lot of drugs create problems. So when I was first introduced to the concept of ketamine, I didn't really truly believe in it that much. I figured, it's one of the class medications, and I've seen some negative effects from people, so I kind of stayed away from it. Yet a lot of my clients who are substance abusers, they would say, "Well, what
Yeah.
about this?" And I would automatically say, "Well, you don't want to introduce another drug to your system. It's not good. You're trying to get off one drug, so why take another
Yeah.
drug?" What I didn't realize, and I've learned since then, that it actually helps to get off the other drugs.
Mhm.
And I've seen firsthand how it does. So I've learned. I actually um, administer myself to, I took a few doses myself to know exactly what it feels like. I was able to do a lot of research. Went to NIH, a National Institute of Health. I've read
Mhm.
some Harvard studies, and I really educated myself to exactly what
Yeah.
ketamine does. And when I saw the effects on some of the clients, I thought, wow, this is amazing. This is something that I cannot accomplish
Mhm.
just by conversation. This
Yeah.
is kind of a direct way of dealing with your brain that is so mysterious to us. And here's a way to do this in a very safe manner.
Yeah.
So I learned and I changed, and now I'm not only a true believer. I use it with my clients consistently, and it's really helps them.
Got it. Well, this is awesome. The work that you're doing, that you're helping so many. Can I ask a question about, is there specific like criteria that you must meet to become a candidate to use ketamine therapy? What is the backstory to it? Can anyone try it, or it has to be someone that's diagnosed with something?
Well, we use it for clinical purposes.
Okay.
So we have to do an assessment. And generally, if I mean anybody can take it for recreational reasons, even
Got
to
it.
try it to see how it feels like. There's no negative outcomes for this.
Yeah.
However, when it comes to what we use for
Mm-hmm.
therapeutic purposes. So yes, there's an assessment. A person should have would have a condition such as depression, is primary anxiety, post-traumatic stress disorder, OCD, and I'm not talking about like being preoccupied with certain rituals, but actually having a severe OCD, that's obsessive compulsive disorder. So yes, we would not want to just give it out for
Mm-hmm.
recreational purposes. Others will have a club here, and everybody comes in for getting high. This is not the purpose of what we do. We
Wow.
literally want to make sure that you get better, and there's appropriate treatment that goes with that.
Got it. Now, let me ask, how many years have you been doing this for?
So the ketamine only a couple of years.
Mm-hmm.
I've been doing psychotherapy since I would say in I was in the field since mid '80s until now. I've been a doctor since '99. I've been a licensed psychologist since 2011. So it's been quite some time I've been applying therapeutic interventions. But
Mm-hmm.
ketamine I've been doing for about 2 years or so.
Yeah. Wow. And you know, a lot of people, by the way, just want to ask about the long-term management. If you're doing it this way, the safe way, or is there still addiction that can occur, or how do you, as a doctor, manage that?
It's a really good question. I get that asked all the time. So you can have addiction towards almost anything, work, sex, video games. I mean, we look at addiction as being attached without having control of anything. So as as a ketamine being that it's a very pleasant experience, and it is a pleasant experience once you get into it.
Mm-hmm.
They call it the K-hole. You go into a K-hole. And so most likely would not get addicted, but anything could become addicted. So that's the danger. This is what we monitor. We won't give you dosage necessary for you.
Uh-huh.
If you're doing it on your own, um, and you enjoy the feeling, you can get addicted to the feeling. Is there a physical addiction? Not really.
Yeah.
You don't
Mm-hmm.
get physically addicted to it, but psychologically you can, like almost to anything.
Mm-hmm. Yeah.
So what happens is we give 6 administrations. That's the national standard for those who have severe depression or
Yeah.
anxiety or other conditions. After that, and it takes about a month to go through this process, to the first week, to the second week, one to third, one to fourth. That's 6 administration. Many people come back within about 3, 4 months just to get a booster. And we're not talking about another 6 administration,
Yeah.
just another booster. Some people do boosters every 4, 5, 6, 7 months. Some people do
Mm-hmm.
boosters one every year. Some people don't do boosters at all. So we've
Mm.
found so far that it doesn't really have those addictive qualities that you would have with other substances.
Yeah, exactly. Well, I just love that you're experienced in this. You're well trusted in the community. You're well reputable, and you know what you're doing. Just to streamline out there, this is not the same as doing a street drug called ketamine. This is not. You need to go to a doctor and seek professional help to be using this stuff. Just to clarify, right?
Yes. And we do a
Mm-hmm.
consultation prior. So we do pre-ketamine consultation. We want to sit down, we want to find out your condition. We do an assessment, medical assessment, psychological assessment, just enough so we are comfortable what we administer is going to be appropriate to you, not just because you want to come in and have a good time.
Yeah. All right. Well, what else do you want people to know about these alternative therapies? Did you want to stick with ketamine today or ask any other, talk about another topic? By the way, 631-307-4010 if you have any more questions.
I'd love to entertain some more questions. It was a great question that came through. Um, I'll talk about other things as well because I think it's kind of important. And you know what, the things that I do are very interesting. So, what I'd like to talk a little bit about the ketamine assisted therapy. Not everybody does that. So, ketamine assisted therapy is actually applying therapeutic technique with a ketamine during or after.
Mm-hmm.
And it's not everybody have done that because many facilities that open up don't even actually have a CAP therapist. It does take training to be a CAP therapist besides your regular training because you're now dealing with images. You're dealing with different things that come up from the past. You're dealing with a different kind of a feeling that people experience. When I do therapy during the ketamine process itself, it's a very different process. Persons have conscious. They look at you, they talk to you differently, they feel differently. And so that takes a bit of work in order to be able to identify some of the issues that they're dealing with at that particular moment. What I found a lot of times people become very
Mm-hmm.
open to discussion and they're
Mm-hmm.
talking about a combination of things that are reality plus unreality. Because yeah, you see things. Some people have
Of
like
course.
hallucinations, images, and some of these things are not reality based, but they are
Yeah.
associated with previous past experiences.
So
A
true.
lot of people choose to do it afterwards. In other
Yeah.
words, they want the full experience of ketamine, and then we come back and we talk about the images and the past experiences that arise based upon the experience that they had during ketamine.
Got
And
it.
so that opens the door. It opens the door to people trying to figure out exactly what those images are coming from. What are the fears they're dealing with? Um, what are the other associated issues that are associated with themselves that are not came through while they were
Yep.
doing ketamine sessions?
Actually,
So,
someone just wrote into the website. They just text me. There's a question.
mhm,
Uh, Potential side effects. What are the common side effects or
mhm.
risks associated with ketamine therapy from Gene in Oklahoma? Oh,
Um, Yeah, that's good. But I've actually already answered, but I'm going to say it again because it's a really good question, and those people actually have um, uh, come up with different, you know, how would you say, necessary questions regarding what are the side effects. So the most common side effect is nausea. People feel nauseous. We instruct people not to drink heavy liquids or the colored liquids or eat food for about 8 hours prior to
Uh-huh.
having ketamine session. Um, so that would be very common. We do give medication to counteract it. That would be one of the side effects. The other one is your blood pressure might rise. And so, therefore, if you're having conditions in blood pressure or heart conditions, we don't advise it. That would be a side effect. You're going to have an increased blood pressure.
Mm-hmm.
Um, you might have a hallucinatory process where you might get a little scared, not knowing exactly what it is during the actual process of ketamine. So, what we do, we have a pre-session where we set up goals, we instruct what to think and how to go into the state in a positive mindset. These are the three
Major.
major side
Okay.
effects. Generally, there are no more side effects than those.
Well, that's a good thing because clearly the benefits are outweighing the side effects, but you have to just acknowledge that. And that's a good question that Jean that you sent in. Thank you. What else do you think is important for us to know about this? I mean, I'm just curious, can you use ketamine assisted therapy along with other modalities too, or is it one or the other?
Of course you can. So we also add neurofeedback, and I mentioned neurofeedback
Yes.
last discussion. And again, not many people do this, but I've been doing neurofeedback for the last 20 plus years, and it's again a very powerful way to retrain the brain. And if I apply this with ketamine, it actually becomes extremely powerful, very powerful way to deal with all kinds of conditions. If you're
Mm-hmm.
not familiar with neurofeedback, neurofeedback is retraining of the brainwave activity using computer video games. We attach electrodes to your head as you are reading your EEG in real time, and then your brain plays the video game according to the parameters that we found during the assessment. So with
Yeah.
ketamine, you open that door to the for the brain to be more open, more flexible. With neurofeedback, you reconnect those brain activity, brain waves, and neurons in order to be able to have better brain plasticity. With the
Oh.
one you open, the other one you kind of solidify. That's
Mm-hmm.
a really powerful way of using all three modalities: ketamine, ketamine assisted therapy, and also neurofeedback.
Yeah.
And that would be an
Okay.
incredible protocol.
Perfect. That's good to
I
hear.
think the one thing that we did not mention that's kind of important to know, people always ask me, should we take medication along with it? What if I'm already on medication?
Okay.
And
Good
the answer
question.
is one doesn't take away the other.
Okay.
You can if you wish. What we found is that once you start doing ketamine therapy, you find very little use for medication
Yeah.
because you actually, you help your depression, so that kind of goes away. But then it's not we're not against it.
Yeah.
You should talk to your psychiatrist or medical professional regarding medication and
Okay.
their, perspective of ketamine. But you can do both.
All right. Well, thank you so much. And in our last 2 minutes together, how did you want to leave off for your listeners, for your viewers? And thank you again for calling in, about this work and how important it is to have alternative, therapies and modalities for people.
My suggestion is I when I work with the clients is I want them to know, I want them to learn, and I want them to be just given
Yeah.
this particular treatment. I would like to tell the people who are listening, please do some research. Go on and learn about these different methods. Find out who does what, who find out the research that's being done. I think it's important for public to be educated about just about any kind of methodology that we use. So my suggestion is don't just go in with like a closed mind or open mind. Read, learn, and then discuss it with professionals.
Got it. Well, thank you so much. And how can we reach out to you for more?
954-367-6261. That's the phone number. You can go to bewellrehab.com. We have all the services regarding the therapeutic services, and also we do the ketamine at Hallandale. That would be Ketamine Clinic, South Florida / Hallandale. There are a few of us. We are located in Hallandale, Florida, near Aventura Mall. And I'll say
Ah,
this: it's a new direction in therapy.
mm-hmm.
Ketamine as a new direction in therapy. That's my new logo that I'm going to be using.
Thank you so much. All right. Excited to have you. And this looks great. Had a great conversation today. Thank you again for our caller and to our people Jeannie, who wrote in. And unfortunately, we're out of time. So we got to call you. We got to reach out to you. You're the best, doctor.
Please, waiting for those phone calls. I'm eager to help.
Tell us the website one more time.
BeWellRehab.com.
Perfect. Well, thank you so much for being here and being well and with all your expertise. We appreciate you and looking forward to next week.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.